Familial Mediterranean fever is actually a dysfunction of the neutrophils. It is a familial genetically derived dysfunction, which is actually autosomal recessive, and it occurs in persons of Mediterranean origin. Now, what's the key consequence of familial Mediterranean fever? Well, the neutrophils are not functioning properly, and they can become activated and actually create an attack of acute inflammation. And that attack of acute inflammation is not really driven by infection, but instead is sort of this dysfunction of the neutrophils. And it classically presents with fever, which is what you would expect with inflammation. So it classically presents with fever. It also will usually involve serosal surfaces. And so if it's going to involve serosal surfaces, we'll get some very classic findings. For example, if it involves a serosal surface of the heart, that's the pericardium, it can present mimicking myocardial infarction. If it involves a serosal surface of the abdomen, it can present mimicking acute appendicitis. And so these are some circumstances. These are some of the classic clinical symptoms of familial Mediterranean fever. Now, what's important for this particular discussion is that when a patient has an attack, there's going to be a lot of inflammation. And a byproduct of that high inflammation will be production of acute phase reactants, and one of those acute phase reactants is SAA. And so if SAA is produced during an attack, that can deposit as AA, which would then obviously be AA amyloid, which can then result in amyloidosis, secondary amyloidosis. Now, what are the classic clinical findings? Essentially, what you should be aware of is that amyloid can really deposit in multiple